surgery today. This is our last surgery of the day. We've done 2 cervical Deuk laser disc repairs. The first one was a C3-4-4-5-5-6 for 3 herniated discs that were causing neck pain and right arm weakness, numbness, and pain. That patient's already gone home. Our second patient was a C4-5 herniated disc with severe stenosis and spinal cord compression. That patient did not want to stream his surgery live, so we respected his wishes, and that surgery was not streamed live. And here we are with our third and final surgery. Now this gentleman has back pain and right leg pain. He's got 3 herniated discs. They're really bulging discs. There's annular tears at each level, and there's a little bit of herniation. So right now the first step is to position the patient and then place these spinal needles transforaminally, because that's the way we're going to access the herniated disc. Shot. The patient is comfortably resting. He is in twilight anesthesia, which means he's still there when we need him, but he's comfortable and otherwise pretty snoozy. Shot. So I'm aiming for L4-5 now. Shot. I'm up against the facet joint and I want to get around it. Shot. So I'll drop my hand and I'll use the bevel shot of the needle to guide the needle to the shot. L4-5. You okay? Shot. All right, so we're about to enter the foramen. I'm going to go a little bit further. There's the herniation. We're good there. I could feel there's a big tear. Blood pressure is good. All right, so we have one more to access. That's L3-4. Now I'm going to try to do L3-4 through the same incision, but I'm a little concerned because I'm kind of aiming up. Just lay still. We're almost done, all right? You're doing great, by the way. We're almost done. I'm going to put you to sleep in about 10 minutes. And then when you wake up, we'll be finished. So I'm going to go for 3-4. See where I can go. Shot. Well, we might actually get this done. You can actually see the almost the shadow of the disc. Lay still. You're doing really good. Shot. 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 So I would like to hit the facet. Shot. And then just kind of slide along the outside anteriorly. Then I know I'm in the right spot. Shot. You're doing great. That's the facet. That's a really good trajectory. I'm going right around the outside towards the disc. It's pretty awesome. Shot. You're doing great. We're almost done. You have any pain? Where? In your back? All right. We're at your last painful disc. So, all right. I'll let you settle down for a moment. Shot. All right. So we did it. We got in through one little cut, 7 millimeters on his back. So if we were doing there's really 2 types of surgery that will cure back pain from a herniated disc. The Deuk laser disc repair, which is, you could see, no fusion, no metal, just a little cut. We go in and repair the disc. It's the best surgery there is. Then there's fusion, where we have to clean the whole disc out, put a cage in there, screws and rods. If we did a fusion, the incision would be from here to here. Okay, you guys see that? It's about 12 inches. But we're not doing a fusion. We're doing Deuk laser disc repair. The patient didn't want fusion. So there's 3 discs we're going to test. L5-S1, L4-5, and L3-4. Are you comfy? Yes. Great. No pain? All right. How bad is that on a scale of 1 to 10?
9.5.
Is that where you typically get back pain? All right, so L5-S1 was a 9.5 over 10. Is that where you typically get your pain? Yeah. So, amazing, huh? We found one of the causes of his lower back pain that he gets typically, and it's a disc herniation at L5-S1. Not a big one. It's an annular tear. You can see there's a grade 4, grade 5 tear. You can see the herniation coming out of it too. Okay. I'm sorry about that. Is that better? Just a little? All right. So we know the patient had pain because he arched his back, he tensed up, and he said, ouch, ouch. You guys might not have heard it, but I did. You better now? You okay?
Yeah.
He's good. All right. Good. You think you said booyah, right? Yeah. How bad is that on a scale of 1 to 10?
8, and then what's the 10?
10. All right. We want the highest number. So L4-5 is a 10 over 10. Is that where you typically get your back pain? Yes. So that's concordant. All right. Have you been counting? Have you been counting? How many discs did we test? I tested 2. Look at the pressure, guys. Watch this. This thing is like coming out. See that? Now it's staying in. You better? I'm sorry about that. No hard feelings. How bad is that on a scale of 1 to 10? Is that where you typically get your back pain? All right, so 3 discs. One is a 10 out of 10 at L3-4. We've got a 10 out of 10 at L4-5 and a 9.5 out of 10 at L5-S1. So you get to go to sleep now. When you wake up, that pain will be gone forever. Wouldn't that be nice? So why do we do this? We do it for several reasons. One, we want to confirm that the discs we're fixing are the cause of the patient's back pain. And indeed they are. Number 2, we want to inject a little bit of dye in the disc so I can actually see the tears. And you can see them on x-ray. That L4-5 tear is the biggest one. Yeah, right there. And then, of course, there's tears at L5-S1 and L3-4 as well. There's dye right there in the epidural space. Go back to that L3-4. You can actually see all that black dye. It's kind of wrapping around the herniation. You can actually see where the herniation is. It's right where the white stuff is before the dye, to the left of the dye, right where, yeah, that right there. So you see how it's bulging out? That's the herniation. And the dye is kind of outside the herniation, between the herniation and the nerve root right there. So it's pretty cool. What this tells us is that this patient's back pain is coming from those 3 discs. And we could see on the MRI scan that he has 3 discs with annular tears and bulges. Now, they call them disc bulges because they are. They're bulges. Most doctors would just look at this MRI, look at this patient and say, we don't know where your pain's coming from. Go do physical therapy. Go to pain management. And this patient would be doomed for the rest of his life to live in pain. Why? Because doctors don't take patients' back pain very seriously. And they don't know how to figure out where it's coming from. Even though we have the tools called discogram, they don't understand the discogram, they don't know how to do it, they don't know how to use it to gather important information. Long story short, this patient got the Deuk spine. We figured out where his pain's coming from. It is 3 bulging discs in his lower back. And we're going to fix those today with the laser surgery. Okay, let's take another x-ray. Our guide wire's in place. I'm going to remove the needle. And what I'm left with is just the guide wire. Now, I have a cut that's 7 millimeters long, maybe 8. And I'm bringing in this dilator. You see the dilator here, Kevin?
Yes, sir.
It's like a skinny metal pencil. It's going to go down. It's not going to cut anything. Look at the tip of this thing. It doesn't have a cutting tip, it has a spreading tip, and that's important. Cutting things cause bleeding and scarring and damage. Spreading things don't. You can spread tissues apart like fascia and muscles and not damage them. So that's really what we're trying to do here with this surgery. We're trying to spread things apart so it doesn't cause damage. And then we're going to put a tube over this thing, and we're going to do the surgery through the tube. I'll show you that in just a minute. But right now, I need to get this dilator into the disc, right through the tear. It's actually going through the tear right now as we speak. And to be quite honest with you, it's a pretty big tear. So it's going in. It's not too hard to get it in. It's pretty easy because the tear is so big. Big tears mean big herniations. Shot? All right, take that and this. All done. All right, so now we haven't really done the surgery yet. We're going to do the surgery in a minute, but I need to put this metal tube down. It's got a fenestrated end so I can actually see at 12 o'clock the annular tear and herniation immediately. Down we go, and then of course we're going to impact it down. Sean, I'm going to use my x-ray while I'm doing this, Sean. And we are inside the tear at this point. You're doing great. You just relax. Surgery's going well. Sean? All right. So we're inside L5-S1. This is the 9.5 out of 10. 10 being the worst pain of your life. This patient has a 9.5 out of 10 from this disc. Come on, come on. What are you doing? Get your scope ready. All right, you hold the laser, I'll get the scope. So here's our scope, and the scope is just a slang term for endoscope. You can see the endoscope has a long shaft with a end that I work out of, irrigation, light source, and camera. And then it's got a working channel at the end. And the working channel starts here and ends at the tip. And that's how I do the surgery. I go down and bingo, red, white, and blue. Very patriotic of this patient. I can always appreciate a 4th of July disc. That's part of the herniation. I'm going to use the grabber to pull out as much loose material as I can. Remember, we're inside that tear. So the pink stuff is inflamed tissues. And the blue is stained with our stain. That stain is called indigo carmine. And the stain itself will stain nucleus. Nice job, guys. Good work. Flynn, you're doing a great job, buddy. Now this is our big laser fiber, the 1 millimeter. Only a guy would say a 1 millimeter fiber is big, right? You're okay, just relax. You're doing great. We're in the L5-S1, that's your 9.5 out of 10. I have a feeling it was probably a 10 out of 10, but the anesthesiologist has done a great job. Now you're from Holland originally, right, doctor?
My father was born in Holland.
I like Holland. I've been there a couple of times. Just passing through, of course. You know. Amsterdam is a gateway to Europe. That airport there. Schiphol or whatever it's called. Schiphol. Watch the fiber on my face. I need you to wipe it. And actually, the issue is down there. So there's the tear. Once we clean this tear up, I think the patient's going to feel a lot better. Now, one of the most common things we encounter after surgery is some patients will have pain coming from other areas in their back. And that's one of the things we have to deal with commonly. The most common is the piriformis of the facet joints, those two. Piriformis is a torn muscle in the buttock, and a lot of patients don't even realize they have it. We try to diagnose it ahead of time and before surgery and treat it so that they don't have that pain. Is he okay?
Just checking.
Yeah,
Check
good.
the set ahead.
Yeah, please do. Please do. Safety first. First, second, and third. And the other cause is facet syndrome, which is the facet joints. We always try to diagnose that because a lot of our patients are from out of town, and we don't want them to leave and end up having issues that have to be injected with specialty injections like the piriformis. So it's important to make the diagnosis while they're here, if we can. Doesn't always work out perfect, but the good thing is that a lot of the interventional procedures can be done elsewhere safely in other countries, other cities. So the laser surgery cannot. We're the only place you can get this done. All right. So you're fine. Everything's good. Doing great. Just relax, and we've got 3 discs to fix today for this gentleman. This will be the first of 3. I'd like to start at L5-S1 just because it's tricky, and I want to make sure that we address any issues that might arise there first. The irrigation seems to be working quite nice. Huh? Don't jinx it? All right. Okay. Any questions from the audience?
No, sir.
Why don't you run the animation then that shows why herniated discs do cause pain in the back, like the pain this gentleman's having.
Yes, sir.
Can you do that? Thank you.
To the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back after watching the animation. And we just showed you why herniated discs cause pain. It's all about inflammation that happens along the annular tear, especially when the annular tear gets filled with nucleus pulposus, the jelly located normally in the middle of the disc. It squeezes out, extruding through the tear. Unfortunately, when that happens, the jelly gets stuck within the tear, and it causes a cascade of inflammation. And inflammation is where all the pain comes from. So what we're doing here today with the Deuk laser disc repair is we're removing the source of inflammation, which is the nucleus pulposus stuck inside the tear. And we call that an annular debridement. In addition to debriding the annulus, see, there's the tear right there. And that's that wad of nuclear material stuck in there. This is the source of pain. So if I clean it out with the laser, then the disc will heal properly, like it's meant to heal. And that's the magic of the Deuk laser disc repair. We do all this without any implants or any metal, any bone, any cadaver bone, any fusion. None of it's done. We do it naturally. We let the body heal naturally. We basically help the body heal naturally with this procedure. That's the gist of the Deuk laser disc repair. It's really the only surgery that allows the body to heal naturally without damaging it. Things like laminectomy, microdiscectomy, you're removing bones and ligaments out of the spine. You're weakening the spine. So the patient's more prone to having injuries later on after surgery, where they get more and more herniations and complications. But with the Deuk laser disc repair, we're not removing any bones or ligaments at all. We're actually passing through the torn annulus, the annular tear. That's the only thing we're doing. By going through an already damaged part of the spine, we're not creating new damage. And that's why the surgery works so well. No new damage is created. Why don't you show our audience the next animation that explains what's done during the Deuk laser disc repair.
The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Wrapping up the L5-S1, we're almost done, and just need a little more of this nucleus pulposus to get out of here, and we'll be done. Now this disc is going to heal by itself without anything. My patients that have this surgery don't need supplements. I'm not going to try to sell them supplements they don't need. There's a lot of doctors out there selling supplements they don't need, patients don't need. Yeah, you're okay. You're all right. Lay still. The only supplement he needs is propofol. Right, Dr. Verndes? Right about now. You want me to wait? All right. So we've watched the video on why herniated discs are painful. The tear gets filled with the nucleus pulposus that shouldn't be there, and that causes inflammation and pain. Then we watched the video animation on the Deuk laser disc repair, and we learned how the Deuk laser disc repair actually goes in, and I use a laser to clean the tear and debride it. At the same time, I remove the herniation. Let me know when I can proceed. By the way, I stopped the irrigation, so you guys are seeing the development of small blood fumaroles. Pretty cool, huh? Let's go see some red blood cells. Could actually see individual red blood cells there. All right, here we go. Irrigation back on. You're doing great, buddy. Lay still, hang in there. You're doing awesome. We're almost done at this bottom disc. You can see how big the tear is, though. It's huge. We call this a grade 4 or grade 5 tear. In his case, it's like a 4.5 here at 5.1. A grade 5 tear is one that has a big herniation associated with it. He doesn't really have a big herniation associated with it. That's why I call his tears grade 4.5. Need just another minute and we'll be done at this level, and we're going to move on to the L4-5. This surgery works, folks. We've never had a patient we didn't get rid of their back pain from the disc. Now, we have patients who have pain from other areas, like I talked about earlier, piriformis syndrome, facet joints. So don't think about the Deuk laser disc repair as the surgery that gets rid of all back pain. It only gets rid of back pain from a herniated disc. So if there's a different source, we need a different procedure. And that's why we have the Deuk endoscopic rhizotomy, laser-assisted rhizotomy. And what that is, it's basically using the endoscope to find the source, the pain nerve responsible for facet pain. And then we zap it with a laser and get rid of it. So. Let's see the grabber. Standby laser. At this point, I've removed about 80% of the herniation. I'm going to see if I can grab any out. Sometimes the grabber can be helpful. Remember, normal disc nucleus is white. All the blue stuff you're seeing is abnormal. All right, take it. Laser on. By the way, L5-S1, the disc we're doing now is absolutely the hardest one to get to. So we've been fortunate able to get to it most of our cases and not have to abort it. In this case, his L5-S1 is going really, really well. I'm very pleased. It's a bigger tear than I thought originally. If you look at the MRI, you can't see any of this. You really can't. You're going to miss all of it. So being able to see this, you have to know about it with your own experience being an endoscopic surgeon and going into a lot of discs, thousands of discs. And when you do that, you can start seeing things on the MRI details that make you realize, okay, this patient's disc is causing their pain. Things that other doctors just overlook and blow off. And unfortunately, and the reason why we do these broadcasts is because we don't want people out there suffering with chronic back pain when we could fix them. And the doctor tells them there's nothing that can be done. Well, there's nothing that doctor can do. They're right. But there is something we can do here at Deuk Spine Institute. Would you put a link up for people so they can see our free MRI review, which we have available. If you know somebody suffering with chronic pain in their back or neck, send their MRI in. We'll take a look at it. We can usually tell you what's wrong and usually fix it.
Yes, sir.
It's mri.deukspine.com.
Free MRI review. Who are we and what we do? With world-class physicians on staff, the newest and most advanced technology, Deuk Spine Institute has performed thousands of procedures and achieves a 95% success rate in elimination of pain. Treatments? Every patient comes to us with a unique set of challenges. That's why we address every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk laser disc repair, Deuk spinal fusion, rhizotomy, epidural injection, kyphoplasty, physical therapy. Meet Dr. Deuk, world-renowned board-certified neurosurgeon. Go to www.mri.deukspine.com. Click the Free MRI Review tab on the upper right. Complete the patient information form. Continue to fill out Step 2 of the form. Make sure to submit all your MRI images, plus report. You can submit the MRI through the mail, file upload, or medical record release. You can drag and drop or upload images into the form. Things to remember when submitting your free MRI review. All MRI images must be submitted along with the report in order for it to be reviewed. Once your case is reviewed by our team, a patient advocate will contact you. Thanks for choosing Deuk's.
Out the area. It's called betadine. Don't poke yourself. I'm irrigating this stuff out. Good job. You're starting to think like a surgeon. Flynn? Yeah. You understand? It's not just about handing instruments, it's about handing the instrument the right way. All right. Let's get the roller. You hand it to me. I'm going to take this tube out, and we're done at L5-S1. We're going to move on to the L4-5. Meanwhile, I'm going to put a little bit of pressure just to stop any vein bleeding that goes on in the muscle so we don't get a muscle hematoma. Let's go lateral. We're going to bring the x-ray machine back in so it can guide me to do the next disc. I'll need to put the dilator in, I'll need to put the guide wire dilator tube, and I need help seeing the spine to know how far in to go. And that's what the x-ray machine does. So you can't do this surgery without the x-ray machine. All right, I need the guide wire. So I'm going to place the guide wire into the L4-5 disc at this point. Yep, move those up. And let's get a shot. All right, beautiful. So I'm going to take this next shot, this next needle out. I'm taking the L4-5 spinal needle. It's 18 gauge. Nothing magical. I need the dilator. Now we've got a nice train track a guide wire. I call it the train track, the monorail. And this monorail, in the spirit of Disney, right, Dr. Bernders? The monorail, in the spirit of Disney, okay, guides us to the next disc, which is going to be the L4-5. Patient still asleep. Beautiful. Shot. And we're going to advance into the disc. And remember, this patient does not have big herniations. This patient has small bulges, but they're very painful. Shot there, is that it? Alrighty then. Yeah, it went right, it just literally fell into the tear. So we're going to put our tube. This tube is what we do the whole surgery through. This is true minimally invasive spine surgery. You hang in there, buddy. We're almost done. We're about halfway done. Shot? You're doing great. I know it's terrible, but sometimes I feel like Hannibal Lecter. Whoa. Anybody ever see that Silence of the Lambs 2? Or no, it's called Hannibal, right? You know what I'm talking about? With the where the guy is awake, huh? Anyway, this is not really awake surgery, but it's kind of awake surgery. So it really kind of qualifies in some aspects as awake surgery, because in the very beginning the patient is awake, and then we give the patient some sedation for the more painful parts, and then we kind of lighten them up when they're we're not in the painful areas. So it's kind of up and down, in and out. We use a medication called propofol. It's quite a wonderful drug. It's wonderful because it puts you to sleep, but then when it wears off an hour later, when you're done, your mind is very sharp. Okay, we are at L4-5. It's a little small arteriole there. I need a grabber. We're going to get the laser next. Get it ready. Yeah. There's your tear right there, folks. Let's clean that thing up. Once again, the blue is the nucleus pulposus that's degenerated. And the reason it's degenerated is because it's been broken down by inflammation. So think of it as what a forest looks like after a fire goes through it. It's not the trees burning, though that fire is also going on. It's the brown or burnt trees, the blackened trees. That's what we're looking at here. This is the effect of inflammation on nucleus pulposus and on the disc itself, and that's called degenerative disc disease. Unfortunately, most doctors don't understand that concept. They don't know what causes degenerative disc disease. They're scratching their heads. They haven't been able to figure it out. All these years of research and funding and NIH studies and collaboration with their buddies, steak dinners, cocktails, highballs. They've never been able to figure out why people have degenerative discs. The answer is simple: inflammation. Basically, arthritis of the disc. Over time, that arthritis destroys the disc. Jordan, don't go too far. All right. We'll see you soon. I love this big laser fiber. Huh? It's just so efficient. I like efficiency. Are you kidding? Wow. So where are you staying this week?
Hotel.
Oh, you are?
Yeah.
So you decided not to go with that house?
The roof was unrepaired.
Bad shape? Well,
But I made an offer on another house, and the roof's in better condition.
good.
So I think I'm gonna buy that one.
Excellent. When do you guys close?
I think 5th of March.
End of March?
5th of March.
5th of March. The most important thing is, does your wife like it?
Oh, she likes it a lot.
Oh, good. No, does she like the new house?
Yeah. My wife seems to know it. It's about a mile. Yeah.
Kevin, any questions?
No, sir.
All right, so we've shown the video on why the herniated disc cause back pain, and we've shown the video animation on how the Deuk laser disc repair works. We've shown also on how to submit an MRI, should you want to have it checked out at Deuk Spine by our team to figure out why there's pain in the spine. And again, the causes of back pain are many, but the most common causes, the ones that account for almost everybody's back pain, are very straightforward. And they include, number one, the herniated disc, annular tear, basically the annular tear, which is what we discovered at Deuk Spine. Number two, facet joints. And number three, most commonly is going to be fractures of the vertebral bodies. Insufficiency fractures, they're called. There's lots of doctors that treat insufficiency fractures, mostly orthopedics, some neuros, some pain management, and it's done with a procedure called a kyphoplasty. We do those here at Deuk Spine Institute as well. You only need to treat fractures that are actually unstable and they continue to collapse. Just like a herniated disc, they have an initial insult where you get a fracture, and then after some time it heals partially but not completely, and then some minor lifting incident then causes another fracture to occur. So it's a cycle of repetitive fractures over and over again. That's not what we're dealing with in this patient. This patient has a tear in the back of the disc and the wall that's allowed the nuclear material to squeeze out. And that tear is being repaired right now through debridement. It's the first step. Now your body tries to do this, what I'm doing right now with this laser, it tries to do it on its own using inflammatory cells like macrophage, polymorphonucleocytes, basically white blood cells. And the problem is it would take this body somewhere in the order of you need to have the whole thing around it. You can't just use your finger. You understand? Can't be half Raytech, half finger. This inflammatory process the patient's body's engaged in will fix this tear in about 100 years. So until then, he's going to live with pain while the disc degenerates and collapses, and the inflammation eventually goes away when all the nuclear material is gone. That's what a degenerated disc is. When you have bone on bone, it's because there's no more nucleus. It's all been destroyed by inflammation. So I'm helping this disc heal faster with this procedure. It's a natural procedure. There's no fusion, no metal, no artificial bone or discs. You don't need any of that. Unfortunately, most spine surgeons don't know how to do this procedure. So people aren't going to hear about it unless they do their research. Any questions from our audience?
No, sir, not at the moment.
They know everything.
You explained it too well.
I gotta keep them guessing a little bit then. All right. About 5 minutes, we'll be done with this L4-5 disc, and then we'll move on to the last one, which will be the L3-4. How's our patient? Excellent. Good to hear. Everything okay?
Yeah, I'm just checking, just do a little surveillance, checking
Good.
pressure points.
So what do you do in your free time, Dr. Berndes? Golf?
I do golf. I like to do a lot of hiking, walking. I like to walk a lot. Go to the beach all the time. Anytime I get.
You gotta join Joe.
What's that?
Joe.
Joe likes to walk.
Oh my gosh, he loves the beach.
Oh, okay.
That's his son right there, Flynn. Tell him. How crazy is your dad about the beach?
Goes to the beach very often. Yeah, I love the beach.
He surfs too, apparently.
That's cool. Yeah, where I go, there's no surf at all. It's like a lake. Looks like the Gulf.
Yeah,
It's always very flat water. Oh, yeah.
interesting.
The waves here also aren't that big.
What's that?
The waves here also aren't that big, but they're bigger than land.
But the swimming and the snorkeling is the best of the best.
Really?
The Keys, where I live, yeah, it's beautiful. So we do snorkeling and swimming.
Can see a lot of fish.
Yeah, it's great.
Really?
They have a really big reef there. It's called Red Reef. It's well known.
What kind of reef?
It's called Red Reef Park.
I didn't know that.
North of John Pennicamp.
Just how far off the coast is the reef?
Probably 50 yards, 55 yards.
So you can just swim right to it.
It's great.
I didn't know that. Now you've got me interested.
And we live on a golf course too.
I might have to move.
We have a golf course there too.
I don't golf.
Probably not good for your back.
No, it's not that. I just no time.
Right.
I don't know, man. Seems like I just don't have time.
I don't golf much.
Huh? Well, I hope you do golf. Just because my social life sucks doesn't mean yours has to. Right? I literally, by the time I get home, I'm just drained. And then I gotta go to dinner with my kids and my wife, which I enjoy. And then I've gotta become a taskmaster to get my kids to do their homework. I might get an hour of television and then I'm done. Toast. Then again, I've already done all the fun stuff in life. You know, back in high school and college. Partied. Man, we spent entire summer in Tijuana, Mexico, just visiting all the clubs when I was 16. Everybody in San Diego, that's all we did. Go down to Tijuana, go to the nightclubs, drink, dance till 2 and 3 in the morning. So I had my fun time. Played sports. Now I just focus on my work. I enjoy what I do, helping people. Would be nice to take a break though. I'm kind of gonna have to take a break soon with Arias for his racing in Europe. So that'll be my vacation. Being on a loud, stinky, hot racetrack. That's not much fun, I can tell you that right now. It's nice to watch racing from your home. How much did we put into this disc? It's not bad. We're pretty much done here. I'm going to move on to the last disc, L3-4. How's our last patient doing? Is he ready to go? Okay. So it's interesting because if you were here for the earlier surgeries, that patient that we did first was in recovery. I went to check on him. He was doing good, but he was complaining of pain in his forearm. And I looked at his forearm and he has a tennis elbow. So we did a tennis elbow injection in the recovery area. And I can't wait to see him tomorrow and see how he's doing. I think he's going to be doing much better. But the point is that when you get a patient with pain, not all their pain comes from one place. You know, you got to really pay attention and figure it out. Okay, done. We're done here. Let's see. The nerve root's down there. Hold on, let me just show the nerve root. Again, pretty much covered in fat, but that's the nerve root there. Let's get the laser one more time. I just want to blast that little blue area. What are we going to say, Dr. Berners?
I was hoping that the first patient didn't have all that surgery on his shoulders because there was referred pain to the neck that was missed.
Yeah. You're okay, buddy. We're done. You're great. You're doing awesome. Scope up.
I was just thinking about the neck only.
Thinking about what?
I was thinking about the neck referred pain to the neck TKD going to the shoulder. Does he have multiple shoulders?
Yeah. Yeah, he had multiple shoulder surgeries. You're right. Not by me.
Sometimes you see that.
Somebody did it. Yeah, I agree. You're okay. Let's go. I need that. We're almost done. You're doing great. Oh. So we put in a little antiseptic just in case. That's what the brown stuff is. It's called betadine, developed by NASA. And it's just really good at disinfecting. Should there be anything, I always need my roll. You got to give me the roll.
Good stuff.
You're good, you're good. We're almost done.
On the last disc, okay? You're doing great.
Yeah, you got another 15 minutes, we'll be done. Just lay still, we're almost there. Your pain will be gone tomorrow. You guys ready? Jordan, you ready? Guide wire. I got it. Shot. 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 That's the dorsal fascia. That's so tough. Shot. Shot. Perfect. You're okay. You're doing great. Don't move. Yeah. No, it's not local. That's not the skin that's hurting. That's the disc. Let me know when you're ready. I can't put local down by the disc. That's where the root is. Shot. You're okay. Yep. Shot. That's it right there. Nice. It's beautiful. Last one. Lay still, okay? Tell me when I can proceed. Now? Shot. 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 That's perfect. Yeah. You got him or what? You got him? So one more disc to go and we're done. All this through one 8mm incision today. Lay still, you're doing good. Tell me when I can proceed. Are you gonna hang? Is she hanging? She hung it?
No, the propofol infusion right now.
Oh, got it.
Reloading. Well, I can make it full case with that.
That's all right. It happens.
We have a question from Teak.
All right, Teak.
Yes, sir. Teak from YouTube.
How do you spell the name?
Teak.
Teak. Welcome.
Why is he so light on sedation? Does that happen with people on narcotics already for pain management?
Why is the patient so light on sedation? Does that happen in people with narcotics from pain management? The answer is no. No. You know, the patient is getting an IV infusion in his vein. And what we want is we want the patient to be light and then deeper when there's more pain from the procedure. So light when there's not so much pain, deeper when there's pain. And it's just like this, kind of like a carousel, you know, up and down in terms of their mental status. So it has nothing to do with the amount of drugs that they normally take for pain, even though that can definitely affect how much we give them. But it's really just normal to be up and down. We want them to surface. It's kind of like a whale coming out of the deep ocean to breathe and then going back down holding their breath. So it's really very similar to that, because the more we give the propofol, the less responsive they are, but the less they breathe on their own. So since this patient doesn't have a ventilator or a tube down their throat, you got to prevent that. Come on, move it. Move the gray down there. Yes. So we cannot put the patient all the way out. If we do, they stop breathing. Then we have a real problem. So it has to be done like a whale in the ocean, down and up, so that it stays alive. This is probably one of the toughest anesthesia cases. Wouldn't you agree? For adults? I mean, of course there's heart surgery anesthesia, but you know, from a regular procedure standpoint, prone, laying down, you know, poor access to the airway, and IV propofol sedation it's one of those situations that most anesthesiologists don't like being in because it has risk. But it's an acceptable way to do it, and we need the patient able to talk to us. That's why we don't put them under general. I need to know if I'm too close to the nerve root. The patient will tell me. And that's exactly what happened in this case today. If you go back to the beginning and watch, you'll see that I was too close to the nerve root at L5-S1. The patient was complaining of leg pain. So I had to redirect. I had to come in at a different place. I had to go at a different angle. So it really makes a difference. You got to have the patient participating, helping. Now I can tell you this disc here is far more degenerated. We okay? This disc right here is one where I can see the scar tissue is pretty significant inside the disc. Luis, you've done a great job as always. Thank you. Luis is the man behind the scenes that runs the show. Make sure everything's working, along with Flynn and Crystal and Jordan. So the patient's coughing a little. You can see how with the coughing the disc bulges. Let's see if he coughed. There, right there. You see that? So coughing increases the pressure inside the disc. Something that we doctors have known for a long time. We call that a valsalva. And valsalva is an increased pressure in the abdomen that transmits throughout the body. It's okay. Hey, as long as he's safe, I'm happy. I don't mind the coughing. We're almost done too. Probably another 8-10 minutes max. So has anyone ridden on the, look at the inflammation. Has anyone ridden on Velocicoaster?
Yes, sir.
You did it, huh?
It was amazing.
Wasn't that incredible? Best roller coaster I've ever been on.
Best roller coaster, yes.
For sure. For sure. If you haven't been to the Velocicoaster in Orlando, it just opened up, I think this year. 2021. And what an experience. Just absolutely insane. What's your favorite part of it?
The part where it's close to the water on that turn.
That upside. We need suction. Help out. Suction, please. Let's get over here, Crystal. Thank you. Yeah, please hurry up. Luis. Do you guys need Luis's help, or you want another nurse? If you need me to end, I can end. Crystal, you should always have suction set up every case ready to go. All right. Just about done. Probably 2 more minutes. What else can we get you, doctor? Huh? What's going on? You can lighten them up. We're done.
Oh no, I got everything off.
Yeah, good. This is one of those tears that you can see kind of go down to the right here and kind of avoid this other area. So you can see tears are not always dead center, but sometimes they're closer to the end plate of one vertebrae.
Like you lost suction.
So there's nothing I need to do about it.
Like it was king.
Scope off.
This sounds like you're breathing well. Another one?
The vomit.
I think yeah, a little mucus. We got it.
No emesis.
I didn't see any. None.
You don't need to aspirate any, right?
So now would have sat at 99. Think we got lucky. Sometimes when you're deep and you get a little mucus touch the cord, it can just be mucus too.
I understand.
Or your sinus is drained in that position.
I don't mind if it's mucus. We're done.
How
Here you go.
doing, buddy?
Take it.
You alright?
Pull it.
How are you? We're all done with the procedure. You alright?
Just a little little laryngospasm. Just breathe. You're good. Just breathe.
You're doing great.
All right. We're all done. If you have any questions, type them up. I'll be happy to answer them for you, but we're done. All 3 discs fixed with one little cut. This patient's going to go home in about an hour, we expect. Outpatient. No metal, no fusion. And I feel like we've gotten the source of his back pain. So 3 discs were repaired today. Any questions?
No, sir.
EBL 2 mil, no comps. DLDR. Right, everyone agree? L3-4, 4-5. Is he okay? 5-S1? Great. All right, thank you.
John, you doing okay? We're all done. John.
All right, I'll head over there, and if you have any questions, keep them up, and I'll be right there, okay?
Perfect.
Dr. Ara Deukmedjian here at Deuk Spine. February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed two discs. You had herniated disc at L4-5, L5-S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Ara Deukmedjian. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you say, what are you going to do now? They say, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you, and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deukmedjian. I'm here with one of my patients, and you traveled to Duke Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Duke Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Gone.
And is that because we have you doped up on powerful painkillers?
Nope. None
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes.
but the symptoms came back.
Came back.
Yeah. All right. Well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. We did orthoscopic.
That's right. Arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah. I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. the laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you gonna do?
I'm gonna go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Deuk Laser Disc Repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-Strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs. Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, 2 patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. Deuk laser disc repair, a comparison.
Every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk laser disc repair, Deuk spinal fusion, rhizotomy. How to request a free MRI review. Who are we and what we do? With world-class physicians on staff, the newest and most advanced technology, Deuk Spine Institute has performed thousands of procedures and achieves a 95% success rate in elimination of pain. Treatments? Every patient comes to us with a unique set of challenges. That's why we address every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk laser disc repair, Deuk spinal fusion, rhizotomy, epidural injection, kyphoplasty, physical therapy. Meet Dr. Deuk, world-renowned board-certified neurosurgeon. Go to www.mri.deukspine.com. Click the Free MRI Review tab on the upper right. Complete the patient information form. Continue to fill out Step 2 of the form. Make sure to submit all your MRI images, plus report. You can submit the MRI through the mail, file upload, or medical record release. You can drag and drop or upload images into the forum. Things to remember when submitting your free MRI review. All MRI images must be submitted along with the report in order for it to be reviewed. Once your case is reviewed by our team, a patient advocate will contact you. Thanks for choosing Deuk Spine Institute.
Dr. Ara Deukmedjian here at Deuk Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L4-5, L5-S1. And you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Ara Deukmedjian. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you say, what are you going to do now? They say, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you, and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deukmedjian. I'm here with one of my patients, and you traveled to Duke Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Duke Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Gone.
And is that because we have you doped up on powerful painkillers?
Nope. None
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes.
but the symptoms came back.
Came back.
Yeah. All right. Well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. We did orthoscopic.
That's right. Arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah. I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you going to do?
I'm gonna go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain.